Lately, I've been spending a lot of time talking about healthcare stocks, particularly the cost containment plays, because I think they're just right for this uncertain environment, even through euphoric session like we had today. Mostly when we talk about controlling healthcare costs, we mean companies that can use their scale to negotiate down prices with drug makers or hospitals. But tonight we're going off the tape to check in with a cutting-edge privately held company that's revolutionizing the very idea of healthcare cost containment. I'm referring to Doctor on Demand, a service that enables patients to video conference with their doctors over the web, something that makes getting medical care a heck of a lot cheaper and a heck of a lot more convenient. The company's service is available to both individuals in exchange for a flat fee, or businesses can provide it as a benefit to their employees, like they do at Comcast, the parent company of this network. However, Doctor on Demand isn't the only player in the field. Walgreens just today announced they plan to expand their own telemedicine service into 25 states by the end of the year, and Teladoc, the largest company in the industry, just filed to come public a week and a half ago. So not only is telemedicine a game-changing concept, it could soon be an investable one. And that's why I want to check in with Adam Jackson. He's the co-founder and CEO of Doctor on Demand, hear more about how his company's doing and also the broader industry and the changing face of the healthcare landscape. Mr. Jackson, welcome to Mad Money. Good to see you, Adam. Have a seat.
Thanks for having me.
All right, so we teased this, to use the technical term TV, this morning on Squawk on the Street. And immediately, three of the people who were on the set told me they use Doctor on Demand.
Right.
And I said, what? And it was all these instances of things that you kind of just say, why do I have to go to the doctor for? I know exactly what's wrong. Why do I have to lose a half a day? I mean, this must be the common experience that you're replacing.
That's it. We hear that exact phrase every day from our users. If you read our App Store reviews, they say the same thing. They would say, I can't believe this worked. It was just that easy.
Now, when you do it, I have to believe that if you're, say, for Comcast or something, there's a screening mechanism. We know that I don't want to see any old doctor, so to speak. Mm-hmm. How do I know I'm seeing the right doctor, a good doctor?
Sure. So in our application, you can actually browse a list of our physicians, see where they went to school. Our promise is we only employ board-certified, American-trained medical doctors. So you're not getting a nurse and you're not getting a PA. It's an American board-certified doctor.
Okay, but now we have this Teladoc, we have Walgreens. How about if they have the same promise? Why would I use you versus them?
Well, there's a couple options. First of all, if you're a consumer and you just hear about us on TV or in the App Store, you're going to use us because we're the only ones that go direct to consumers. You can get us in the App Store. Even if you don't have insurance, it doesn't matter. Put your credit card in. For $40, you can see a doctor. That's a lot cheaper than $200 at urgent care or much more expensive ER. If you're getting it through your employer, like your benevolent parent Comcast offers Doctor on Demand for free to the majority of their employees, then it's built into your health plan. So use Doctor on Demand because it's built in and it's covered.
Well, okay. At what point does the doctor say, listen, you got to come in?
Yeah. It's about 8 to 9% of our cases.
That's it?
That's about it, yeah.
And do you think that's because it's younger people and workforce people? Because I was reading in USA Today that the people who are, say, Medicare, older 80, they're like using almost all of the medical. Most of the people that you deal with are healthy who have an illness, as opposed to people who are ill.
That's not totally true.
Okay.
That's a reasonable assumption, but that's not actually true with us. We actually have folks in their 80s and 70s using our service. About 10–15% of our population is over 65. These people do have chronic conditions, but they know inherently that they can't get treated for get a cancer diagnosis or get diagnosed with diabetes over video. It's just not appropriate. You got to still go in for that. So people realize, oh, well, this is a video interaction. Well, I know for pink eye or for a pediatric question or for something simple, this will probably work. So they're sort of self-selecting.
Okay, now how about if there's a medicine that is not a life-saving medicine but more cosmetic?
Yeah.
Or something, Latisse, for Allergan, which is now Activist. They have a website, and you call and you get a doctor. I mean, could Doctor on Demand affiliate with drug companies? Or is that a bad idea?
Yeah, I don't think we'll go that route. The reason being, we don't want to put any pressure on our physicians, our provider staff, to feel like they're under any obligation to prescribe anything. We'd rather have patients come to us because their insurance plan or their employer or someone else they trust told them about it and get an honest and unbiased medical opinion.
Better to work for United Healthcare.
Yeah.
So tell us about that relationship, because they're the king.
Sure. So we're now built into United Healthcare. They're the largest health insurance company in the country.
Built in means what for people who don't have United Health?
So built in means for the companies that United serves as a TPA, benefits administrator, we're now on the menu. So if a company that uses United to administer says, hey, we'd like telemedicine, they get Doctor on Demand. Starting in January of 16, if you're part of their fully insured book, so the 8 million or so lives they're at risk for, Doctor on Demand is now a covered benefit, meaning you can use it either for free or very cheap.
Okay, and how do you make your money off these?
So our business model is really simple.
Okay.
It's $40 for a medical visit, period, end of story.
But, I mean, how do you share it with the doc?
The doctor gets about 30, and we take about 10.
And that's enough to be able to have a very thriving business.
It is at scale. So at low volume, makes no sense. It's really expensive. We lose money. At any kind of reasonable, moderate to high volume, we're in good shape. It's a profitable company.
Can I ask you how you got Comcast's account?
Sure. We went in and pitched the benefits group. Comcast has an incredibly forward-leaning, very open to technology. Their mission with the Comcast benefits team is to provide the best available care as soon as possible, right? So they looked at all the vendors, loved our experience the best, loved our business model, and that's how we won the business.
Are there some big accounts that are now going to be jump ball, that that's Teladoc's got some money and Walgreens wants to be in this?
We go through an RFP, a request for proposal process, several per week, sometimes almost 10 a week.
Really?
Yeah. With big health plans, big self-insured employers, we go head-to-head with the competition, including Teladoc.
All right, well, I want to make sure everybody, it's not a public company, but you understand that the value proposition is so compelling that if it were public, we would have to be talking about this during our healthcare series, because that's how compelling this company really is. That's Adam Jackson, co-founder and CEO of Doctor on Demand. Really great business model. Great stuff that you're doing. Mad Money's back here after the break. Booyah! Jim Cramer here from Mad Money. Thanks for watching CNBC on YouTube. Click here to subscribe and get the jump on my exclusives with CEOs, plus market news, investing advice, and a whole lot more.